Hi, good morning everyone. My name is Castellan G. Lumanta from PSN Group 712G. So for today, I will be showing you the necessary equipments or materials inside the public health bag. But first, let us define the public health bag. So this is very essential or very important equipment for a public health nurse because this is the bag that she will carry or that she will bring along whenever she goes out for home visitation. So we already done defining the definition of a public health bag. So let's now talk about the principle of using it. So first is that let's put in mind that the bag and the contents of it is very important because we can be able to use it whenever there's an emergency need. Second is the bag and the materials inside of it should be cleaned as much as possible. Third is that the bag and the contents should be protected from contacts with any particles or any articles coming from the patient. Fourth is that we actually arrange the materials inside the bag. So the reason of it is that to avoid confusion. Fifth is we do hand washing. The reason or the rationale for this is to avoid or to prevent spreading of microorganism to the bag and to the materials. And lastly is that we need to clean thoroughly and disinfect the materials after using after assessing the a patients with a communicable disease. So these are the materials that is inside the public health bag. Let's proceed on performing the bag technique. So first thing that we will be doing is place the bag in a flat surface, either table, chair, or floor with a protected paper lining. So after looking or after checking for a flat surface, let's get the paper lining and the plastic lining. So let's open the bag. Let's get the paper lining. So the folded part should be facing the table. So after we place the paper lining, let's proceed on placing or let's place this bag in this right corner and the strap beneath the bag. And then let's ask for a basin of water or a glass of water if the faucet is not available. So we have here the basin of water and let's put this in outside the working area. Then let's get the plastic lining inside the bag. So place this here. For getting the basin of water, let's take out the hand towel and the soap. So the hand towel inside the plastic and then the soap. Let's put this in this right corner, and then let's proceed on hand washing. We do the hand washing, let's open the bag again and take out the apron. And that apron is for us, for our uniform to be protected. We have now the apron. So after we wear the apron, let's get the necessary equipment that we will be needing in the assessment. So let's open the bag. We have here the kidney basin. Let's just pretend that this is a kidney basin. Next is the alcohol. We have here the 70% alcohol. The cotton. Our digital thermometer. Betadine. And then after that, let's place the paper plastic or paper receptacle outside the working area. And then let's also have, don't forget our stethoscope and our BP apparatus. After we place the materials, let's proceed on performing necessary nursing care and treatment. So after the treatment, let's clean and alcoholize the materials or the equipment that we used. So we have here the 70% alcohol and the cotton. Let's alcohol the things that, or the materials that was used during the assessment. So after we clean the equipment, let's proceed on hand washing. After the hand washing, let's now put this materials or this equipment back to the or inside the bag. So after we do the hand wash, or after we place back the materials inside the bag, let's proceed on removing the apron. So the inside or the outside should be folded, or the dirty part should be, or the contaminated part should be placed inside or folded inside. And let's put this in our bag. After we remove our apron, let's proceed on hand washing. So after we do the hand washing, let's fold the paper or the plastic line. And let's place it inside the bag. Let's record the assessment or the treatment that you have done to the patient. And then after recording everything, let's get the bag and the paper lining. You go. So after that, let's get our bag. And then let's fold this plastic lining. Let's put it in our bag. So those are the things or the equipment that we will be using on the home visitation, and as you can see, we already done the bag. So that would be all. Thank you.